Good morning, everyone, and thank you very much for joining us for a discussion on environmental health and environmental justice. We are delighted to be joined by two expert speakers, Catherine Cleary and Dr. Kevin Credit, whom I'll introduce you to now in a moment. My name is Rose Wall, and I'm the CEO of Community Law Mediation and its Centre for Environmental Justice. To those of you who don't know us, Community Law Mediation was set up in 1975 as part of the Campaign for Civil Legal Aid, and today we assist more than 4,000 people every year through free legal, mediation and education services. We also campaign for law reform and for the safeguarding of rights already enshrined in law. We work in areas of law which are not catered or not catered adequately for by the Legal Aid Board, and this includes housing, employment, equality, social welfare, debt and children's law. And in February 2021, we expanded our work by setting up Ireland's first Centre for Environmental Justice. So what is environmental justice? Well, it seeks to ensure that climate change and other environmental harms do not disproportionately affect those who have contributed least to the problem, and that the state's response to environmental challenges addresses inequality and protects the rights of present and future generations. Earlier this year, we held a webinar on air quality in response to the government's National Clean Air Strategy consultation. As this is so relevant to the topic of today's webinar, I'd like to provide a quick update on that process. So the publication of the National Clean Air Strategy is still awaited. One of our recommendations for the strategy was the adoption of World Health Organization guidelines as legally binding standards. A report from Ireland's EPA showed that air pollution exceeded WHO guidelines at 38 of 67 monitoring stations. This is significant given that the WHO published its new, more stringent global air quality guidelines in 2021. These guidelines confirmed that there are no safe levels of air pollution, and the EPA's State of the Environment report states that air pollution is the single largest environmental risk in Europe. In Ireland, it contributes to the premature deaths of 1,300 people every year. Parallel to the development of the National Clean Air Strategy, the EU Ambient Air Quality Directive is currently under revision to, amongst other things, align the EU standards more closely with the WHO recommendations. However, we believe that Ireland should not wait for the EU to revise the ambition of its air quality laws before enshrining WHO standards in our national legislation. Interestingly, residents of cities across Germany and Belgium are already suing their regional governments over health concerns caused by air pollution. These cases are challenging the government's failure to adopt WHO guidelines into law. They are arguing that by leaving air pollution laws unchanged, the German and Belgian authorities are exposing people to levels of air pollution that are up to 4 times higher than scientists have deemed as acceptable to breathe. The Irish government has signed the solid fuel regulations into law, which require new health standards for solid fuels. This is a very positive development given the health impacts of dirty air. However, it is CLM's view that the Energy Poverty Action Plan should have been published in advance of the solid fuel regulations. 29% of Irish households are now estimated to be living in energy poverty, the highest number ever recorded. Many households in or at risk of fuel poverty may rely on traditional sources of fuel such as turf or wood to heat their homes. They may not be aware of the significant health consequences of doing so. The negative effects of emissions caused by the burning of solid fuels can be compounded with serious impacts on health and well-being. Air quality is therefore not only a matter of health, but of economic and housing justice, which is very much linked to energy poverty. The Energy Poverty Action Plan must therefore be published as a matter of urgency, and the fuel allowance scheme must be doubled in accordance with the recommendations of the ESRI. Back to today's event, we have 2 guest speakers today, and we hope to have a short time at the end of this 1-hour webinar for Q&A. If you would like to ask a question, please put it in the Q&A box in the bottom of your screen. And if you see a question like the one you want to ask, please like that question with the thumbs up icon. Our time is short, so I'd like to now introduce our first speaker, Catherine Cleary. Catherine is an award-winning writer. She loves living in a city, but hankers after the solace of nature, and so founded Pocket Forests. Catherine believes planting trees is something we can all do to help create ecosystems on our doorsteps and bring beauty into our cities. She loves ash trees, black coffee, and is a recent convert to scalding cold sea swims. Fair play to you, Catherine, and thanks very much for joining us.
Thanks so much, Rose. It's lovely to be here, and I'm thrilled to be part of such a wonderful organisation. I have huge admiration for the work of the CLM and Rose. I think you're a real climate hero. It's I suppose a little bit ironic talking to you on a day when we have a real deluge, and these are increasingly happening in our weather. I'm just going to share my screen and get started. I can Sure, sorry about this. It always takes a little bit of boostering, the official term for this. There we go. So we're going to get started. No, that's a share file slideshow. Yeah. We're going to get started with a little microdose of forest bathing. We can take a little moment to have a look at this. Even looking at a picture like this of a forest has been shown to lower our stress hormones and our blood pressure. So you can imagine what actually being in this ecosystem or being able to experience an ecosystem like this in an urban area can do for our mental and physical health. And that's really our starting point as pocket forests. This is a very recently built social housing scheme in our neighbourhood, and it was the lack of green space in our neighbourhood that prompted Ash Conrad-Jones, my co-founder, and I to found Pocket Forests in 2020. We were locked down to our 2K lockdown in a part of the city, the South Inner City, that has the least amount of green space per person in Ireland. We have less than a square metre of green space per person. The WHO recommends about 9 square metres, so we are chronically nature deprived. These lone trees that were planted, we have another slide of those. I'm not sure if this picture was taken in winter or summer, but you'll see later on that they did not do well. That lack of connection to nature is a huge problem. We felt that we could live in cities and we didn't need any natural environments around us, but now we know that the reverse is true. We seriously need these. Physical and mental health can benefit from having trees, high quality green spaces. There's such interesting studies showing that lower levels of Alzheimer's, higher birth weights, better mental and physical health enjoyed by people who live in neighbourhoods with a large amount of tree cover and high quality green spaces. The 330-300 rule is a really interesting model. I quite like it because it looks like a tree when you put it down the screen like that. But the 3 is, can you see 3 trees from your window? You could all try it wherever you are now. Can you see three trees, hard to say, from your window? Does your city have 30% tree canopy cover? And are you 300 meters from your nearest high quality green space? So the answers to those 3 questions are very different depending on where you live in Dublin. We know from the research by various local authorities and also the Mapping Green Dublin project with Professor Gerard Mills. Sorry, there are those questions. So the 3, 30 and 300, that the answers to those questions really depend on where you live in Dublin. So the tree canopy in Dublin is about 10%. It's a third of what that 330, 300 recommends. We have a lot of work to do. We have even more work to do outside of Dublin and outside of rural areas. Our national tree cover is around about 11%, and less than 1% of that is native woodlands. A lot of our tree cover is monoculture Sitka spruce forests. So similarly to what we need to do across Ireland with a reforestation programme, we need to reforest our cities for our health. And as you can see, we're already in an unequal situation with our tree canopy cover. So in the South Inner City and the inner city areas, GCC area, it's about 10%. In Dún Laoghaire-Rathdown, it's 18.9%. So literally, it's twice as leafy in the wealthier parts of the city. Gerard Mills found that his maps are very interesting to look at, and one of the newest developed areas of the city, the Docklands, he was appalled to find that there are virtually no trees there, or there were virtually no trees there when he did his study. So even though we know now that these are necessary, not just for our health, but for the health of our cities, the physical infrastructure that trees can help bring to a city are becoming more and more essential. They help to alleviate downpours. They can prove more drought resilient. The water that's falling torrentially from the sky today is going to end up in our already overloaded wastewater treatment system, and trees can really help with that. So this was our starting point for starting pocket forests. We have 0.69 square meters of green space. Sorry, the clicking noise is my dog wandering around in the background here. As they say, that the WHO recommends 9 square meters. David Attenborough is talking about people not protecting what they don't have any experience of, and so few of us have experience of a native woodland. It's such a scrap of habitat that's left for us, and it's mainly in very remote parts of Ireland and very difficult to access. So we came across this idea called tiny forests, which involves planting very densely very young trees, which again is a very unusual thing to do with tree planting in cities. Urban tree planting typically involves semi-mature species, which are brought in from nurseries, having been maybe grown there for 10 or 15 years. They have their roots pruned and they're typically planted as a lone tree. As we can see in a couple of slides on that, that's a very tough situation for a tree to survive. We spent half our time working with soil. So this is a group of us in Artane with the Family Resource Centre in Artane. We did 2 of our small leaf-shaped forests. We like to make them leaf-shaped. So this is just the soil preparation stage, and we use lots of repurposed materials to bring the life back into the soil, because 1/4 of the world's biodiversity is in our soils. And when we do this, what we try to do is mimic the conditions of the forest floor, so that when these young trees are planted in a couple of months' time in bare root season, they're really going to thrive. And the soil preparation season, as you can see from the very happy faces, is a hugely fun event for a community to get involved in. It means a real connection to those trees that are going to grow there for hopefully decades to come. This is our team. That's myself with mud on my face, Amy, who joined us in January, Eamon Vandenberg, and Ash Conrad-Jones, my co-founder. And this was us working in the Oliver Bond flat complex, where we've been really welcomed by the community there to green up some of their areas or improve the green areas that they already have. So these are our numbers. They're actually going to be, by spring of next year, we'll be up around 2,500 native trees, and we'll have 75 pocket forests, and we will have worked with more than 1,000 volunteers. So this is always a rolling number. And that working with volunteers, I suppose it's more communities than volunteers, that typically everybody involved lives or learns or works near the forest that we're making. We plant very small forests, so our smallest one is typically the size of a single car parking space. We go up to about 50, maybe 100 square meters if we've got a lot of help. And we do a 3-step process. So we bring residents or students or workers together. They help us to plan the forest. We look at the resources they already have there. What we don't want to do is put a forest where there is already a habitat. So we typically, if people say, oh, we've got some trees, but we'll get rid of them, we say, thanks, but no thanks. We only put these where there is very little else happening. We do our soil preparation stage, and then we plant small whips in the middle of winter. And by the spring, the following spring, they leaf up and the adventure happens. So why did we do this now? Well, I think it was very striking during lockdown. The increasing concern about the climate and biodiversity emergencies, the yearning I think people had for green spaces was really felt acutely during lockdown. Our parks and beaches and natural habitats were used as never before, I think, by people who obviously we were being forced to socialize outside, and that was part of it, but I think it was also partly to reconnect with something that was still working and still thriving in a way that it felt that the world wasn't in the worst moments of the pandemic. That reconnection with nature benefits the most vulnerable people in society as well, which is why it's so important to try and get these habitats into places where people most need them. We're very ambitious. We want to make this a world-class way to green cities, again, to move away from that idea of only planting semi-mature trees and only planting lone trees. That's not a natural system. And I think the more natural your system is, the more resilient it is. We want to make this a community-based story. We want people to be part of the story of greening their areas. So many people do not have access to their own private gardens. So we feel that these public spaces should be publicly owned and publicly managed in a way that they're not being at the moment. Going back to those trees, this is midsummer, and that tree, as you can see, has died. Lone trees with pruned roots had a desperate summer, and an unintended consequence we didn't realize when we were doing them, but our forests are in their second growing season. So the same day we took this picture, we went to see one of our forests, which is about 100, 200 meters away, and all the trees were fine, even though younger trees are much more drought susceptible because they were planted in an ecosystem, because they were planted with regenerated soil that can hold on to moisture. They didn't need watering and they were surviving. So there's a climate and community resilience in this model. So these are some of our projects. This is the Oliver Bond as well. This is the area of the flat complex down near the river. So we did some raised beds for vegetable growing, and there's going to be some Christmas potatoes in the second bed there. Lexi is doing a great job watering. We have a crew of fantastic children in the flats now who have all become quite expert on how to plant things, how to look after plants, how to very carefully take a plant and put it in the ground and look after it. And that's been very exciting for us to, every time we go back in there to do another project, we have a growing number of experts there who love what they do and love what they're making. This was our first project in Mercy College in Inchicore. It was our largest as well. So we planted 100 square meters of trees and shrubs. So there are 300 trees and shrubs planted in that very small area, which is still maintained. The lawn around it is still maintained, leaving play space and you know, running around space for the kids. But they also have an outdoor classroom now in the middle of that forest, and that's just 2 seasons of growing. So you can see that while they go in very small, they get big fast. We have in partnership with the Digital Hub, where we couldn't have any access to the ground because they had no soil in the area. So we repurposed a skip, put a seat in it, and we've got 10 trees and shrubs in that skip with a metre of what we hope is something like a forest floor with lots of woody materials in it. And we have a small nursery there, and we hold compost workshops. So we've got a compost workshop coming up on the 3rd of December, and feel free to come along 11 o'clock. It's free. Just send me an email to book a space. One of the, again, byproducts of the system is that we've been fascinated by the amount of food waste that could be repurposed into community growing. We're trying to figure out if we can maybe get somebody to put a biodigester in somewhere and do a district composting scheme, because it would be a wonderful circular economy approach to what we do with pocket forests. And that's me done. I'm not sure if I've gone, yeah, probably a little bit long, but I'll take questions at the end. And thank you very much.
Thank you so much for that, Catherine. And I think, like, particularly the issue you spoke about the inequality of green space across Dublin and across the country, no doubt. I think that was really highlighted during COVID when we were confined to our 5-kilometre radius, and if you didn't have a beautiful garden with trees, you were really lacking with that. So it's amazing to see this project doing so well. And also very interested to hear about your work in Oliver Bond. We have had Austin Campbell from Robert Emmet CDP speak at some of our events, and he has spoken about the lack of green space and that inequality and justice issue where communities there don't have adequate access to trees and green space. There's very low level of car ownership, but yet they're seriously impacted by air quality because they're surrounded by so much traffic and so much congestion. So brilliant to see that work. I'm going to now introduce our next speaker, and as I said, we'll have time for questions and answers at the end, so please do put in any questions that you have. So I'm delighted to welcome Dr. Kevin Credit, who's a lecturer in the National Centre for Geocomputation at Maynooth University. Broadly, his research is focused on better understanding how urban spatial structure and transportation systems influence economic, environmental and social outcomes using quantitative approaches and large open source data sets. Kevin's recent work looks at topics such as the impact of transit, construction and carbon emissions, the role of third spaces in new business creation, and the development of spatial and causal machine learning methods. You're very welcome, Kevin, and thanks for joining us.
Thanks so much, Rose. Thanks for inviting me. And thanks, Catherine, for that really interesting presentation here at the beginning, which touches on some of the things that I'll actually talk about as well. So hopefully everyone can see the slides. Great. Yeah. So as Rose mentioned, I am a geographer and spatial data science at Maynooth University, or spatial data scientist at Maynooth University. So a lot of my work kind of looks at quantitative approaches for studying, urban systems and urban interactions. And obviously these kind of issues that we touched on at the beginning, the impact of environmental quality on health and the economy and social justice is obviously an important, a critical component of the way cities function, and something that I've been interested in researching quite a bit. The talk that I have here today is basically aimed at kind of talking about how we measure and study some of these factors using open data. So I'll basically just kick off with like a broad intro to what open data is, why it's important, and then some examples of how we can use open data to, make healthier neighborhoods, to understand what's going on at a deeper level, and hopefully to, inform public policy and actually make an impact on the ground, which as a researcher is obviously something that, being in academia is something that we need to make those connections, obviously, because it's great to do our research and publish papers, but if nothing is actually implemented on the ground, then we're not really making the impact that we should. So, okay, so the first idea here is, what is open data? Basically, the general definition is data that's freely available for anyone to access, download, use, redistribute, or repurpose, right? So the idea here is that we have data that's openly provided that you can use to kind of study conditions on your own, that you can combine with other data sources. Now, oftentimes open data is provided by governments on open data portals. So you may have encountered some of these if you've been collecting data for a particular purpose or for a grant proposal. There's a variety of open data portals for local and national governments around the world. Obviously, there are a few in Ireland as well. The Dublinked open data portal, which is kind of the Smart Dublin initiative. There is the Irish open data portal, data.gov. Census data is often kind of one of the primary, open data sources that is created by governments to allow people to study conditions on the ground. There are European sources of open data like Eurostat. There's a European open data portal, right? And many cities around the world have kind of begun implementing these open data initiatives. A lot of times these data portals provide a lot of information, right? But the data often isn't as open as we would like it to be. Sometimes these are just more repositories for a bunch of data sets that if you don't have a degree in data science or a lot of prior, knowledge or training, might be difficult for you to access or combine. If you want to look at spatial patterns, sometimes the data aren't really provided in a spatial format where you could make a map easily, right? So one of the things that I want to impress through this talk is that the importance of open data is not just kind of putting it up on a website and saying, there, we checked the box, like we have it, it's there. In order for it to really be useful, it needs to be, really accessible and provided in visual formats that, anyone from kind of a layman to an expert could actually access and use. Open data is important for a variety of purposes. Maybe one of the most fundamental is that this idea of democratizing knowledge. So if citizens can't have access to the data, they can understand local conditions and study what's happening in their neighborhoods, right? And this also interrelates to the idea of citizen science, which is, we'll talk about a little bit more in a few slides, but the idea of citizen science is basically having citizens deploy sensors or collect data on their own that they can then use, that is kind of inherently open because it's being created by the people themselves. Obviously, open data is important for researchers because the more open data that's available, the less, it's freely, openly available, means that we can study the important relationships between things. A lot of the very nice statistics and figures that Catherine was mentioning, right? Those come from research studies. And if the data is available and open in order to study those things, then obviously it's easier to do that research. In terms of benefits to governments and businesses, there's also, a variety of kind of economic benefits. So actually, this link is to a study, I think, to an example from the Netherlands, where they made available some of their open education data and actually reduced costs because they, by just providing the data openly on the portal, they reduced the number of inquiries that citizens had, right? So there can be kind of efficiency benefits to governments and also economic benefits because businesses can use this open data too to produce services and analyze markets. And I think this infographic here is from the European Open Data Portal, just kind of showing the overall economic benefits even of open data. So there's a variety of reasons why providing open data is a really fundamentally important thing. So kind of specific to this, the question of the webinar today is thinking about how we can use open data to kind of create healthier neighborhoods, right? So as we've kind of been touching on, healthy outcomes are connected to everyday surroundings and lifestyle choices and kind of the kind of structure of your built environment and where you live oftentimes. So air quality in particular areas can lead to asthma and lung cancer. As we talked about, urban green space and trees have a variety of benefits, right? Mitigating flooding, reducing the urban heat island effect, removing CO2 from the atmosphere. They, increase just kind of the aesthetic value of areas and have mental health benefits. Things like walking and cycling infrastructure. So a lot of the research that I do is kind of related to non-auto transportation. And of course, these have, a range of benefits on, reducing obesity, hypertension, heart disease. So obviously kind of the design of your neighborhood has a big impact on health outcomes, right? And this is something that is probably kind of been known for some time, but is definitely gaining relevance and acceptance, even in kind of the medical profession, right? A holistic view of health that really includes the urban environment. So part of the point of bringing open data into this is that we can't understand what we can't measure, right? We need to have data on these things in order to understand where there are potential gaps, where different groups are facing distinct challenges, right? There might be local knowledge on some of these things if you live in a particular neighborhood, but having the kind of quantitative data allows us to put a number to that, which can be, really important for policy making and for, directing resources to a problem. But obviously, in a lot of places, this data is distributed across various government agencies. It might not exist at all. Again, as I was talking about the kind of openness of open data, oftentimes it's kind of obscured, right, between a number of websites, data formats. So part of the argument I want to make here is that we really need to push for a truly open data at the local level to study these things. So I just want to run through some examples of, different aspects of open data here that we can use to kind of hopefully make policy and direct impacts on improving the health of our local areas. So this Clean Air Together project you may have heard of, this is an example of a citizen science project. So basically the idea here is there are a number of just small air quality sensors that you can sign up to be a part of the project. You put them, outside your home, and you can see that. So there are kind of the official air quality sensors that, that the government maintain in Dublin. But you can see that if we have individual citizens, there are a couple of advantages here. One, you can get a much more dense coverage of the spatial area because air quality, as you can even see from this map, can have a very localized effect. It's very related to kind of the actual path of automobile travel, right? And also obviously the kind of wind and weather conditions, but there are really localized impacts. So if you just have one or two sensors around the city, it's not necessarily giving you the fine-grained kind of picture of air quality that can be really, really important. So this is an idea of a citizen science project. Again, there's also the element of democratizing this knowledge because this isn't being produced by the government, it's being produced by individuals. So, you kind of control that data and are able to use it to make plans. I believe that they ran the project in Dublin and are now working on Cork, but one of the findings, as we kind of touched on, was that 80% of these air monitors exceeded the WHO limits for traffic-related pollution. So again, kind of bringing that important knowledge and on a spatially fine-grained kind of scale. A somewhat related citizen science project is We Count. So this is a somewhat similar idea where you basically have a sensor for traffic. So I believe this sensor is actually kind of a camera that basically detects whenever a vehicle moves outside your window. And this We Count project has been deployed in a number of cities, including Dublin, I think, is one of its test cases. So again, this is a similar idea where citizens can kind of track the amount of traffic, which is of course also related to air quality in many cases, so that we can kind of understand travel patterns, peaks in demand, and hopefully provide a much more fine-grained kind of picture of these processes than would be if we just deployed like a particular traffic counter on one road. Also, I'm definitely happy to make these slides available. I just wanted to mention I have links to some of these projects all here throughout this slide. So if you're interested, I can definitely happy to supply the slides so you can kind of investigate these things further if you're interested. Another example of the citizen science in kind of the Dublin area is, I think Catherine mentioned as well, the Mapping Green Dublin project from UCD. So basically, they use kind of a satellite imagery approach to pick out basically individual trees throughout Dublin, and then uploaded them to this Curio. So this is another kind of open data platform where people around the world actually can upload information can map their local trees in their area and also submit information on kind of the tree species so we can get a sense of biodiversity. And of course, look at some of those kind of structural spatial inequalities in the provision of green space. So this is another kind of interesting tool, and obviously I have this zoomed into the Dublin 8 area. So I happen to live in Dublin 8 and also have started working on a few kind of projects in this area with the Smart Dublin 8 group. And obviously, as Catherine mentioned, like these areas of Dublin are particularly underserved in terms of green space provision, which you can see if you have this data available. I just wanted to touch on, this is an example of some of my research that I've done. So I was previously at the University of Chicago before I came to Maynooth. And obviously, Chicago has a number of kind of structural challenges in terms of racial segregation and class segregation and infrastructure provision and green space and everything. In this project, basically what we were doing is looking at travel times by transportation mode to and from neighborhoods throughout the city. So if you look at this map, basically what we're looking at here are kind of the slowest or the most costly links for cycling across the city. And basically it means that in a lot of these cases, these are places that aren't very well served by cycling infrastructure. And so underneath I have mapped the kind of percent of Black population. So the darker areas are lower proportions of Black population. In Chicago, the city is extremely racially segregated, as you can see just from the map there. But what was really interesting is when we overlaid these kind of most expensive areas for cycling, or basically the areas that are least served by cycling infrastructure, and the Black percent, you can actually see, and it might be a little hard to see on the slide, but I highlighted a couple areas here. Even in the areas on kind of the north side of the city where where it's generally like more wealthy, wider area, the small pockets of poor infrastructure provision kind of correspond to areas where there are small pockets of Black population. So it was a really interesting kind of stark example of looking at, inequality in transportation mobility and these kind of other structural inequalities. And as you can see from this table, again, there's a lot of information there, but we looked at a variety of different kind of structural inequalities in transportation and basically showed, like this box here, transit, bicycling, and walking were significantly slower to and from Black and Hispanic neighborhoods. So, if you live in Chicago, it's something that you know, but being able to use this open data on transportation mobility to really put a number and a statistical significance to these inequalities and to be able to map it, I think is very important and kind of an example of what we're talking about in terms of at least the research impacts of studying these open data products. So another example here, something else that I've kind of begun working on is this idea of energy poverty and urban building energy modeling. So not to go into too much detail, but basically the idea of urban building energy modeling is to create kind of a city or neighborhood wide simulation of energy use, which obviously requires a lot of data on building types, occupancy characteristics and demographics, right? But if we have this kind of simulated energy modeling system, then we can kind of understand which areas of the city have certain deficiencies, which need to be upgraded. We can do scenario planning for future interventions, right? And all of this requires a lot of open data in order for researchers to be able to create these kinds of models. And then the last thing I'll touch on is, so some of my former colleagues at University of Chicago have created this health and environment dashboard for Chicago. And again, I have the link here. It's basically an interactive kind of spatial data visualization map of a variety of different environmental conditions. So things like urban heat, air quality, green space provision. I think the one that's showing in the screenshot here is surface temperature. And then at the same time, a lot of those kind of neighborhood health impacts, including asthma rates and hypertension, and I think even some measures of mental health. So obviously this is a big data collection effort, but the idea of being able to put this open data kind of to use in a very accessible format online where you can just drop down the menus, look at the kind of spatial relationships, I think is really important. So kind of based on this, I've started working with, again, as I mentioned, the Smart D8 and also the Robert Emmett group that we mentioned before on basically creating a somewhat similar health and environment dashboard for D8 and obviously Dublin as a whole. Now, there's some particular issues around, obtaining the data. And obviously, if we're talking about health data, there are privacy concerns, et cetera, that we have to work through. But this is a very, very rough initial mock-up of what the dashboard could potentially look like. But the idea, again, is to kind of map some of these variables in a very accessible way so that citizens, obviously researchers can use these to look at the statistical correlation between these factors, but also hopefully citizens and community groups could use this to kind of identify particular areas of need and make policy decisions to serve those. Okay. So just to wrap up quickly, as kind of I guess solutions or next steps for kind of implementing open data or using open data to actually inform policy. For providers, obviously, the main issue is making the data truly open and accessible, right? Now, sometimes that has to do with quality and validation. There can be big statistical issues if you just basically dump, if you just stream one data set directly to the internet without any kind of quality or validation, that might not be super useful. We may need to take into account representativeness if we're doing surveys, and other kind of basic statistical considerations. And obviously, for this work, but I think for any work that involves kind of urban environment relationships, we also need the spatial coordinates. Like we need to be able to locate these things on the map in space. For researchers, obviously, as I kind of mentioned at the beginning, the challenge for us, I think, is to actually collaborate with community stakeholders and move out of the ivory tower to a certain extent and make those connections, potentially provide expertise on data collection or methodological best practices so that the data that we're actually getting is of a high quality, and obviously conducting research that directly responds to community needs. And for residents, getting involved in data collection and monitoring efforts, working on some of these citizen science projects, obviously helps provide the data that we can use to study these things, and also kind of takes the control of that data into your own hands. So I just have a few parting thoughts, maybe, discussion starters. I'd be interested to hear, some of the folks in the webinar, what your experiences or concerns are with open data, or things you would like to do with data, or things that we in as academics are potentially missing. So thanks so much.
Thanks so much, Kevin. That's so interesting. And very interesting, the transportation mobility inequality study in Chicago. I hadn't heard of that. And I think there are huge gaps around that health and environmental dashboard kind of mapping that you talked about in Dublin and other areas in Ireland. But we do have certain information. We have the tree mapping exercise that Catherine mentioned. There was a recent kind of heat stress mapping exercise done as well. We have the Youth Work Ireland report, which showed that 71%, I think, of landfill sites and waste incinerators are located in areas below the national average of deprivation. And there have been studies around air quality and its disproportionate impact on certain parts of the city and certain groups. So we have some data which is really pointing in one direction, just showing that inequality across Ireland and across the city. But as you say, open data, it's so important, I think, to empower communities to hold government to account and to empower communities to participate in decisions that impact on them, which is a real kind of hallmark of environmental justice. But also, as you say, to inform policy. And, you look at what other countries are doing, for example, the wellbeing framework in Wales and other countries, where they're really looking at kind of that data and those and that information in terms of policy making and legislation going forward. And there is a real gap in that here. I'm going to move to questions because I see we have quite a few in the Q&A box. And the first one, Catherine, is for you from Aideen Loftus. Catherine, love what you're doing. How do you identify the locations for your projects? Are you invited in, or do you propose them to the community?
Thanks, Aideen. It's a little bit of a mix. When we started out, we approached Michelle, the principal in Mercy, and said, we've got this new idea. Can we try it in your school? And she was really open and progressive, and just let us off. And with a group of TY students, we got to work. So we. Our first, as a social enterprise, we were trying to work out a business model for this, I suppose, as well. And initially we thought we could work with private gardens, that idea of maybe using some of those wealthier areas to cross-pollinate less wealthy areas. But we realized very quickly we'd have to, get very markety and go to bloom and become gardener, landscaper type people, which we really weren't able for or qualified for. So we sought project funding, and we got funding. Our first funding came from ChangeX. So we were able to approach, they put a call out, and various schools and communities, community groups, residents groups applied to ChangeX to work with us. And that was brilliant. It was a great start for us. And then we had 2 years of funding under the Woodland Support Fund, which is a Department of Agriculture fund, which finishes this year. So again, that gave us 20 of our very smallest forests, and we were able to go to schools, GA clubs, a couple of hospices and places like that. Our criteria is really to try and put these into places where they're most needed at the moment. We have worked in areas maybe where there's more natural ecosystems happening. We kind of took what we could get in our first couple of years, and I suppose now we get approaches from people all the time, and what we're trying to do is match funding with projects now. So if people come to us with the space and a community that wants to do this, we can then try and find a funder who will be able to put that together. And so far it seems to be working.
Thanks, Catherine. And then a question probably for both of you. Do you think that environmental reports, such as those published by the EPA, are accessible and meaningful to the general public? And how can such data be made more accessible?
I'll let Kevin take that.
Yeah, so I think, and obviously, so I've only been in Ireland for almost 2 years now. So I'm still kind of learning my way through the specific, obviously policy environment here. But I would say in general, government documents or publications, like tend to not be as accessible as we would want them to be. And oftentimes, even if the goal of the agency is to actually, promote an open understanding of what's happening, I guess part of the argument that I'm making here is the data behind those should be open and accessible so that anyone could kind of interrogate what is going on. But my inclination would probably be to say no, and that, in general, and that, we need access to the background information, even if there's a mistake made, but each group kind of, residents and governments all have their own particular, aims and ends. And so it should be everyone should be able to kind of interrogate the same information in order to make those decisions.
Thanks, Kevin. Question for you, Catherine, from Hannah. Catherine, what are the barriers to developing more green space in cities and towns across Ireland?
Thanks, Anna. I think the first barrier is the space, because particularly in our neighbourhood, every square inch is being developed with, 15 stories of student housing typically. Land in urban areas is incredibly valuable. And there is a sense that if you develop housing, the very last thing you think about is your green space. It's the thing that happens once all the important stuff is done. We would love to see a policy shift, and it's great to hear about Kevin's work with Smart D8, because it's a fantastic project which really links all those very linked areas of life. How healthy you are is not just dependent on your own lifestyle, it's also very influenced by your environment, by your air quality, by your access to green space, by the infrastructure that the city has created for you, where you're able to be actively mobile, or it is pleasant to walk around in a city because it's not designed just for cars. So all of those things come together in a project where we get to involve communities with their green spaces. The more of us who live in cities, the fewer of us are going to have private gardens that we can manage ourselves. And I think that's sad, but it's also an opportunity to make green spaces much more of a community effort, which gives people a real sense of belonging. So we would love to see the voluntary housing bodies, for example, looking at the green spaces before or at the very early stages of developing housing, because they are so valuable to our health, and our understanding of how valuable they are is really growing. And I think Kevin's work and that mapping of, we're just looking at something called green prescribing, where a GP might recommend that somebody would go to a particular area and just spend time in trees. There's really good science showing that, again, your blood pressure is lowered, you have a benefit that can last for up to 7 days by forest bathing, and we can dismiss this as, woolly and all very airy-fairy, but it's very real, and there's very real good science to support this. So I suppose the answer about finding green spaces, I think we would love to see more green spaces being found for what we are doing, but also at a policy level that green space is taken much more seriously. It's not just seen as this kind of luxury or add-on, it's seen as the core fundamental thing that you start thinking about when you're thinking about housing.
Thank you, Catherine. Just the next question from Rebecca. For either Kevin or Catherine, often environmental issues are discussed in terms of economic impacts rather than health impacts. Do you think a better understanding of environmental issues as health issues would increase public and political support for environmental action?
Yeah, I think that's a really good point. And actually, before I came to academia, I was working as an urban planner. And one of my initial thoughts when I went back to get my PhD was basically like wanting to do studies on the economic value of some of these things, like public transit investment or walkable infrastructure, because the arguments that are often made, obviously, in the policy arena are all about money. I do think, at least from my opinion, I do think health carries a somewhat similar weight, especially as, like I said, this idea of the social determinants and environmental determinants of health has become more and more accepted. And obviously, like there are even economic arguments you can make about the health impacts, right? Because those have real impacts on a health system. But yeah, I definitely agree. And it's probably something that, as we do more analysis and have a larger body of evidence in favor of these kind of impacts, that's kind of the argument that we need to continually make to policymakers. But I think at the end of the day, people want to be healthy, and that's seen, probably on a somewhat similar level as the economic value, but it is a challenge for making policy arguments everywhere. Always.
For sure. And even when you look at, when it comes to election time, like health is one of the things that are most important to people when it comes to voting, and housing too. They're the top two issues. So it's all connected. Catherine, a question for you from Elizabeth. Does Pocket Forests ever have any engagement from developers or local authorities at the planning stages of developments, or is most of your work on existing urban spaces?
That's the dream, Elizabeth. Yeah, that we would be at the table when those big decisions are made, because obviously that's the time when you can get most impact, I think. We've worked with GCC in the Albert Bond through Austin and through their estate management office there. I think there's still a little bit of resistance maybe to the idea of what we do, because some of the pushback we get is that, oh, well, these are going to be cover for antisocial behavior. So, there's this clear sight lines are necessary in some areas so that nefarious activity cannot happen. I mean, we kind of call bullshit on that, because, I don't think the trees are in any way to blame for what's happening in the area. It's typically, and the more we have these ecosystems, going back to that great question about talking about environmental benefits through a lens of health, I think it's again another reminder of how we are part of this natural world. And the healthier our natural world is, the healthier we are, the healthier the food that comes from a healthy food system. All of those things come together. And it isn't just, it is, unfortunately, I think our health spending is based very much on curing existing conditions as opposed to preventative health. And I think that's where this project comes in. And yes, if we were at the table when planners were planning areas, or our idea was at the table, doesn't necessarily have to be us, but just that idea that instead of landscaping a city, you actually wild a city. Bristol, for example, has just recently declared that it's going to manage 30% of its city space for wildlife, which is an amazing and really ambitious idea. And I think that can, for some people, that might feel, well, what about the people in the city? How, what are they going to get from it? But we know from, we know from working with people in areas where they have very dire, inadequate green space, that the joy that they get from actually working with soil. We had a girl in one of the schools we worked with giving an interview, and she talked about the tree that she planted being her legacy for the school. And this was, I talked to her teacher afterwards and said, where did that come from? And she said that came entirely from her. She wasn't, crying to say something nice about the project. She talked about this being her legacy, her connection to the school, those deep connections that we can have to these kinds of projects. I think it's part of that hopeful thing that we have at this moment. And it's very easy to get overwhelmed by despair and doom about what's happening. But because we have to look at how we fit into the natural world, there's huge joy in that, because the natural world is so resilient. I mean, we have a phrase that we talk about, we take one good step and nature takes 10. And if you can tap into a natural system, it is just the best kind of energy, and it's the energy that keeps us going as well. So yeah, let's bring that energy to the planners' tables.
Thanks, Catherine. And it kind of highlights, I suppose, the importance of participating in consultation around local development plans. Because that's really when you get to have your say. It's much harder to undo things when they're already in the plan, and it's much harder to challenge developments when they're consistent with the plan that's already made. So just to say to anybody listening, to wherever you're based in the country, look at when your next local development plan is going to be drawn up. We did do a session earlier on in the year with Phoebe Duval from Antashka about how you should participate in a consultation process like that, and that's all available on our website. Just next question for you, Kevin, regarding the research that you mentioned on inequality in transportation. How might we go about doing something similar in Dublin?
This is a good question. So actually, some of the data sources that I use to kind of calculate the mobility by mode is essentially available everywhere, because it just is querying travel times along the street network or the public transit network. So that actually is available everywhere. And I have plans to do a somewhat similar study doing international comparisons. So I think in terms of the transportation inequality, it's definitely possible. There are some issues with the different the different kind of data that's provided in Chicago. Actually has a really, really robust open data ecosystem, which is a little bit surprising if you know anything about like the actual government of Chicago and how open they are. But the open data provision is somehow really good, and I think Dublin is quite good. But there are definitely some things that could be made more open or more accessible. And I think there's definitely a bit of a different kind of culture around different agencies and the data that they control. So I think there's some work definitely to do in Ireland, but in terms of replicating something like what we did in Chicago, I think it definitely is possible, because the transportation variables are could really be applied in almost anywhere that has that kind of basically the public transit data that Google Maps queries. That's all openly available. So yeah, definitely possible, and something that I want to do.
If you do it, please come back and talk to us about it, Kevin. A final question. I'd be interested in both Catherine and Kevin's opinions on rural areas surrounding their work. Rural areas can have an abundance of green space which is inaccessible to them due to private ownership or transport poverty. How can we include rural communities in this work?
Thanks, Vanessa. It's a great question. I've recently been doing some work with the Irish Agroforestry Forum and talking to foresters who work with the Department of Agriculture. And there's a great scheme called Neighbourwoods, which is very little used, but it enables a landowner to plant a native woodland and then open it for public access. Apparently there's a great one in Mallow, about 8 acres of native woodlands with paths, fully accessible for everybody. So those kinds of environmental schemes which are funded and allow landowners to maybe use land that is not in use for farming. And actually with the agroforestry model, there's a model for using farmland productively with trees on it. But yeah, it is a huge problem. I think it's shocking how little space in rural Ireland is accessible compared even to Wales or the UK, where there is much more of a culture of walking and access. Obviously, we've had the greenways breaking that a little bit in terms of allowing people to get through parts of the country on bikes. But the more of that, the better. And I think going back to Rose's point about getting involved in local plans, to try and maybe make those calls to local authorities who all have climate action plans on their books now and funding for them as well, to make walking and country access part of your local area. There's a great project with the Burn Bio project as well, called National Heritage Keepers, and they're just doing an open call for groups to get involved. You can see it on their website, burnbio.ie, and that will allow people to maybe do a heritage walk and again access parts of their local community and make it much easier for people to get into.
Thanks so much, Catherine. I'm conscious of time and we like to finish up on time. So I'm just going to wrap up by firstly thanking Catherine and Kevin for joining us here today and for their wonderful contributions, and to you all for joining us on this miserable day and for bringing such wonderful questions to us. Before I finish, I just want to flag a couple of things. Firstly, that this recording will be made available on our website, so please do share it with anybody who you think might be interested. Secondly, we do run environmental justice legal advice clinics, now increased to every fortnight. So if you have any questions around any of the issues we discussed today, around air pollution, around access to green space, around local developments, please do contact us to make an appointment. But finally, and it struck me as Kevin was speaking, we are launching with Environmental Justice Network Ireland a manual for environmental justice in 2 weeks. So it'll be an online resource connecting in communities, citizens, campaigns to one another and to experts, but also to resources like some of the resources and reports that we mentioned today. And so that's going to be available, and we'll be regularly updating that in 9 days. So please keep in touch with us about that and keep an eye out for that. Thank you very much, everybody. Have a wonderful day. Take care.